Hey, good morning, everybody. I am going to go real quick over this general med issues as far as a athletic training standpoint, because we are not physicians, so therefore we can basically look at it, recognize it, and then we have to make the proper referral. The reason why I go over this for me and my aspect, I think every athletic trainer should probably go over this as well, just because you're going to see a plethora of everything depending on what you're doing. But it's like I had a professor one time tell me, you might see a little bit of this, throughout your career. I literally saw it the first 6 months I was working, like all the bad stuff that nobody ever tells you about. And that goes from everything to like recognizing like colds, coughs, upper respiratory infections, to like suicide, sickle cell anemia, and things like that. So it's like those are the big things that you need to recognize. So going on, I'm looking at the PowerPoint here, going on to slide 2. So I have listed here, what is the athletic trainer's responsibility? Okay, our responsibility is recognizing symptoms, but we cannot diagnose. Again, especially in the state of Kentucky, we do not have a medical license to do that as far as physicians go, so we cannot diagnose. So you need to get that through your head. We need to refer to a physician and make sure that it's non-orthopedic. Okay, you would not go see a cough, cold, or upper respiratory infection for something that, like an orthopedic to look at. They're going to sit there just because they have a white coat. They're just going to sit there and look at you and be like, I have no idea. Okay. And then after that, we need to take that family practice physicians or whoever we are referring to that can treat that and make sure that we are responding to their notes and their guidance and treat and monitor. Looking at slide 3. Biggest thing, obviously, I'm going to keep preaching this. You should know this by now, is HIPAA and all the other things that go along with it. Keeping patient confidentialities, including your records. A lot of stuff is now on EMR, so we really don't have to worry about locking up our filing cabinets. But if you do work with somebody that's still old school like that, just make sure the little smallest things that you're keeping confidentiality on that, okay? The biggest thing I want to go over is it's all through preseason. Remember I told you the biggest thing that we can do is preventative measures. I look through every single athlete's physical, and you need to look through them thoroughly. I red flag everything as far as any kind of cardiac spells that they have, especially with minors, because that's when they're growing. A lot of things get picked up like that, like heart murmurs, any kind of asthma, if they carry inhalers, any kind of allergies, if they carry EpiPens. All that stuff needs to be documented, and make sure that you have it in the case of emergency. Okay, you don't want to sit there and be fumbling around and being like, oh my God, I didn't know you were allergic to peanuts because I didn't look through it on your physical. So you need to make sure that all that is right there. Also, identifying key traits or family history. This also needs to be looked up on the physical as well. If you've got somebody that's obese, or somebody that just has heart conditions because of family history, this doesn't have to necessarily be minors. It can be Division I, or if you're working in a industrial setting, these things will light up as well. They have to have physicals before they work, okay? And then identifying factors off-field or lifestyle. Guys, this can be anything, the stuff that nobody ever wants to talk about, depression, drugs, drinking, anything like that. Anything that can obviously lead to addiction or a bad lifestyle like that can obviously be putting that patient or athlete's harm's way. So this is kind of things that it's I can't tell you how to deal with it until it actually goes. It just comes with experience, but definitely identifying and referring out to the proper channels with that, okay? So any kind of general medical eval, one, you're always going to take a good history just like you would with any other orthopedic eval. I like to always carry a stethoscope with me and a temperature reading. First thing I do if somebody comes in, they're like, Brett, I don't feel good today. It could just be a slight temp. I'm going to take their temperature. I'm going to take their vitals because that's what they're going to do anyway if you referral. If you're in good standing with a physician that you know, they're going to give you good graces on that. They're going to be, hey, thanks a lot. They're going to take what you have to consider into the situation, and then, they can refer out from there. But anytime you do this, especially it's hard to in high school, you want to try to take them in a private location and discuss the history. I know it's hard because sometimes athletic trainers just have one big room, and I always wait. I'm like, hey, can you just wait for just a second? I'm going to get everybody out of here, and then we can discuss, even if it's a cough or cold or something like that. You just make sure that they're in a private location. And obviously, if you're a male and there's a female, get another female in there, yada, yada. I don't want to discuss that right now because that's common sense. Use common sense, okay? And then identifying signs and symptoms and making the proper referral, all right? The next couple slides are all about STDs, and basically what I was going to talk to you about that in class. It's not necessarily recognizing STDs like you're sitting here trying to look at it and recognize it and stuff like that. That's for 6th grade health class. What I'm trying to tell you, I want you to treat everybody as if they have HIV. You make sure that you wear universal precautions. Make sure that you're putting on their gloves, everything else. Everybody always asks me, man, you're getting really suited up just to look at this, blood coming out and stuff like that. I don't know what they have. It's nothing against them. I'm just trying to protect myself because I promise you, the biggest thing somebody always told me is somebody is always watching, especially OSHA. You want to make sure that you're protecting yourself and protecting everybody else around you and making the proper first aid precautions and things like that. So that's with STDs. Now down on slide 9, which is MRSA, okay? MRSA obviously is also known as a staph infection. We get this because people did not take their antibiotics through the course of their cycle. And I know everybody is guilty of it. I'm guilty of it at one point in my life. But I want you to get through your head today that you need to start taking your antibiotics through the entire course. Even though you start feeling great, depending no matter what antibiotic it is, all of a sudden your strep throat goes away and you feel great by day 3, but they said take your antibiotics to day 10. Take it to day 10 because this is why this virus is like this, okay? Or this bacteria virus like this, all right? Anyway, this is very easy to recognize, but it can throw you off because of how it presents itself at first. Honestly, it looks like a bug bite, and then within 72 hours, it can be basically fatal depending on how fast it spreads. That's how fast it spreads. So it's like anything that looks like a bug bite. If you get an athlete or patient come to you and they're like, this just popped up, I want you to take it into consideration that it could be MRSA and it needs to be serious, and then you go get it looked at within 24 hours, okay? Your signs and symptoms: red, swollen, painful bumps. Like I said, it gets bigger within 24 hours. It starts to weep fluid or pus. You guys can look at that on YouTube. It is absolutely disgusting. And then they'll start running a low-grade fever and it'll turn into a high-grade fever. Your treatment options: immediate referral, antibiotics, and sometimes they drain the area depending on how big it is. Now looking at sickle cell anemia. This is a final question, okay? I want you to know that about 1 out of every 12 African Americans has sickle cell trait, and 1 out of every 100 Latinos has it as well, okay? It also affects everybody else, especially the people that come from the Mediterranean region. Don't think it's just from African Americans and Latinos. Literally everybody can have it, and the NCAA recognized that, and every athlete has to get blood work, incoming freshmen, to make sure they either get recognized that they have sickle cell trait or they have full-blown sickle cell anemia. Doesn't mean you can't play, doesn't mean that you're crazy or weird or something like that. Most of the time when it's already full-blown anemia, not just the trait, because we can carry the trait and not know it, that athlete will already have known. They've already gotten diagnosed with it. They should have if they went through the proper physicals and stuff like that at a younger age. So we just need to make sure that if they do have the trait, you recognize this is one of those risk factor symptoms that you do. And what I'm looking at right here is the signs and symptoms, okay? They're going to get dehydrated if for some reason this just slipped through the cracks and you did not recognize it, or if they do have it and they didn't treat themselves properly, they're going to get dehydrated faster. It's basically this sickle cell anemia makes your blood thick. It does not deliver oxygen the correct way to your muscles, and it can come on rapid in onset, especially during hot weather days when they're sweating a lot and perspirating, okay? Especially high altitudes. There's some people, especially in the NFL, that cannot come into like places like Denver, Colorado to play because the altitude is so high. There's not enough oxygen in the air and it cannot circulate through the body, and it's a huge risk factor for the sickle cell anemia, okay? So your treatment options, most of the time they know, make sure they stay hydrated. Sometimes they have medication that they take, but in the event that they start having an episode, it's immediate referral to the emergency room. Don't even wait. Immediate referral to the emergency room. You almost want to treat it as if it was a heat stroke, okay? Go ahead and activate your emergency action plan. Call 911. Get them to a cold, dry place. Start getting them as cool as possible and try to give them fluids, okay? Our allergies. I'm not going to go over just seasonal allergies. I'm going over the word that is anaphylaxis, okay? Any kind of allergic to peanuts, bees, things like that, where we break out rapidly onset. These are the things that we need to make sure that we check the physical before this athlete plays or patient you see them, okay? They need to have their EpiPen at all times. I want you to know that epinephrine is not the key drug that sits there and cures this. It only delays it. It gives you about a 30-minute window, maybe, depending on who it is, to get them to the emergency room. I have listed right here on slide 15 a bunch of tons of signs and symptoms, okay? Yes, there are times where we eat food and take medication. We do not know that we are allergic to something and we might not have an EpiPen available. that happens, that you need to make sure. That's why I always told you, especially during that laws and ethics talk, ask them, hey, are you allergic to this? That's the first thing you need to ask, okay? The other thing is you basically got to monitor vitals, because especially if they're going into anaphylaxis, it's going to be scary for them. If anybody's ever been through that before, I have. I didn't know I was allergic to almonds until like 3 years ago, and it was really bad. It's freaky because your airway's closing. You feel like you're having that impending doom. You just need to make sure that you're calming them down, getting your emergency action plan recognized, and then calling 911, okay? Other than that, guys, that's all I have for today. If you all have any questions, holler at me. I am posting Assignment 4 and Assignment 5. Assignment 5 is going to be a bonus, and that is it as far as assignments, and this is actually my last lecture that I have before your final. So it's been a pleasure. I'm sorry that it has to be on these terms. I cannot come into class and say goodbye to you properly, but hope you all the best, and then I'll do one more video, just kind of, like a sign-off for the semester and everything. So just make sure you email me if you have any questions. I got to look and see when the final time. Obviously, it's going to be online. It's going to be just like your midterm. So other than that, guys, thank you all for watching. Have a great week.